a state-of-the-art facility, staffed by a team of highly skilled surgeons, anesthesiologists, physician assistants, and nurses, committed to you, your care, and your recovery. The Morgan Heart Hospital at Morton Plant. Since 1975, cardiac patients from across Tampa Bay and beyond have come to rely on the expert care provided by Morton Plant. The Morgan Heart Hospital now performs more than 700 open heart cases every year. As a patient, you'll have the advantage of the most modern facility and equipment and benefit from the latest approach to heart surgery and recovery. In this short presentation, we'll briefly explain cardiac disease, available surgical treatments, and describe the pre-operative and immediate post-operative care that you'll receive as you take your first steps down the road to wellness. Located in the center of the chest, the heart is a hollow muscle consisting of 4 chambers. Arteries curling around the heart provide the cardiac muscle oxygen-rich blood. Whether predisposed by heredity or as a result of lifestyle, these coronary arteries can become narrowed by fatty deposits that have collected inside the vessel walls. Called atherosclerosis, the supply of oxygen-rich blood is now limited by the narrowed coronary arteries. This results in chest pain or angina. In order to prevent permanent damage, the blocked arteries must be bypassed using a vein or artery taken from elsewhere in the body. Through the borrowed vessel, blood is diverted around the blockage, restoring a healthy flow to the cardiac muscle. Bypass isn't the only reason a patient may require open heart surgery. Inside the heart, blood flow is controlled by the opening and closing of 4 valves. In some patients, these valves become thickened or weakened and must be repaired or replaced. Open heart surgery may also be required to repair an aneurysm, a septal defect, or an irregular heartbeat. In some cases, the heart must be stopped in order to correct the disorder. Every case is different, and your surgeon will best be able to explain your procedure options. If you haven't already been admitted and will arrive at the Morgan Heart Hospital on the day of your procedure, a nurse will call you at home the evening before with pre-operative instructions. You'll be told when to arrive and where to report. The nurse will also review personal items you should and should not bring with you. Items to bring include personal toilet items, such as your toothbrush, comb, and shaving kit. You should definitely bring eyeglasses, dentures, and hearing aids if you cannot manage without them. If you use a CPAP machine to help you breathe or sleep at night, bring it along with you as well. Please leave your wallet, money, credit cards, and jewelry at home. Even your wedding ring must be removed for open heart surgery. It's very important that you do not eat or drink after midnight, and this includes all medications taken by mouth. However, eye drops and breathing inhalers are okay to use. You'll also be instructed to shower with a special soap given to you by your nurse or surgeon. Female patients will shower again the next morning before reporting to the hospital. Male patients will be shaved and showered once they've been admitted. It's not uncommon to be anxious the morning of your surgery. The staff, nurses, and surgeons of the Morgan Heart Hospital know that the prospect of open heart surgery can be stressful to patients and will do everything they can to make you comfortable before and after your procedure. You'll find a free relaxation CD upon arrival to the cardiac surgical unit. This CD is provided to help you relax and rest more comfortably. Ask your nurse for assistance to play the CD. Before you go to surgery, your nurse will check your blood pressure, pulse, height, and weight. You'll also be taught to use an incentive spirometer, also known as your breathing exerciser. You'll use this device to perform breathing exercises during your recovery. Your anesthesiologist will also visit with you and order medications that will make you drowsy. Your family is welcome to stay with you until you're taken to surgery. When it's time for surgery, a member of the surgery staff will escort you to the surgery holding room. Once you arrive, a nurse will check your vital signs and care for you until the operating room is ready. Your family will be taken to the surgery waiting room, where team members will be available to help with anything that they may need. If you're expecting more than a few members of your family to be on hand, please designate one relative as your family spokesperson. When you arrive in the OR, your anesthesiologist will give you medications to make you sleep. Most operations take approximately 4 hours or longer. Back in the surgery waiting room, your family spokesperson will be issued a cell phone so that they can be called and updated during your operation. Once the operation is over, the surgeon will meet with your family and you'll be returned directly back to your room to be recovered on the Cardiac Surgical Unit, or CSU. Once back on the CSU, you'll be closely monitored by a team of experienced cardiac surgical nurses. Admission back into your room after surgery may take as much as 30 minutes. Once you're settled, your family will be escorted to the unit so they can see you and speak with your nurse. You'll be very sleepy when you first awake from the anesthesia, and you probably won't remember much. But you will notice very special equipment around your room. This equipment enables your nurse to see your heart rate and blood pressure at all times. The breathing tube used to administer your anesthesia during surgery will still be in place when you wake up. Each patient wakes up differently, and the length of time that the breathing tube is in your windpipe will vary, usually between 2 to 4 hours. For your safety, your hands will be lightly restrained while the tube is in place. Your nurse will communicate with you through simple yes or no questions. Just nod your head to respond. If you remain calm and follow your nurse's instructions, it will be much easier to deal with the breathing tube. Once the anesthesia fully wears off and you're breathing well enough on your own, the tube will be removed and you'll receive oxygen by mask or nasal prongs. In addition to the breathing tube, you'll have 2 or 3 chest tubes coming from your chest. Now, these tubes drain blood from around your heart and are usually removed 24 to 48 hours after surgery. A urinary catheter inserted into your bladder to constantly drain urine will be left in place for 2 to 3 days. This enables your nurse to closely monitor your kidney function. Lastly, you'll have several intravenous catheters in place through which medications and fluids can be administered after surgery. Control of pain is very important. Your nurse will ask you to rate your pain on a scale from 0 to 10, 0 being no pain and 10 being severe pain. Your nurse will give you pain medication through your IV accordingly. Managing your pain will help you to take deep breaths, cough, move, and sleep more comfortably, important factors to a speedy recovery. Your nurse will give you ice chips once your breathing tube is removed. You'll be advanced to clear liquids, full liquids, and then solid food as you're able to tolerate them. You should be back on solid food 1 day following your surgery and to your regular diet and medications within a few days. It is important that you try to eat as your body needs calories in order to heal. If you're a diabetic, your blood sugar will be tested very frequently and you'll be given insulin as needed. Your nurse will review with you the use of the incentive spirometer and encourage you to take deep breaths and cough frequently. Breathing and coughing helps prevent pneumonia and other complications. You'll be instructed to hold a cough pillow against your chest to protect your incision when you cough or move. Getting out of bed is also an important part of your recovery. A few hours after your breathing tube is removed, you'll be helped to sit at the side of your bed and move to a recliner chair. Most patients are up walking the day after surgery. At this time, you'll begin physical therapy and become more active in your recovery. Your daily progress and treatment will be overseen by your surgeon and his team of physician assistants. They'll be responsible for guiding you through your recovery with the help of the nurses until you're ready to leave the hospital. Many patients are discharged with home health care after 4 to 6 days, but some require more rehabilitation at another facility before going home. Your healthcare team will constantly assess your progress and make recommendations with your involvement. You and your family will watch a special discharge DVD so that you're fully prepared when it's time to go home. You'll also receive personalized discharge instructions as well as our cardiac surgery patient guide that will answer many common questions about recovery at home. The doctors, physician assistants, nurses, and staff at the Morgan Heart Hospital are dedicated to providing you with the highest quality care. They only ask that you trust the team communicate your needs, and work with them to promote a smooth recovery. Remember, you are ultimately in charge of your own recovery and can greatly affect your level of success. We'll be here to support you each step of the way, and we wish you all the best as you take your first steps on the road to wellness.